Meanwhile, the House of Representatives will vote today on the revised plan to repeal and replace Obamacare. Lawmakers are debating the bill right now ahead of an expected vote this afternoon. It gained the support of GOP holdouts after an amendment added billions to cover the costs for people with pre-existing conditions. For more now on the financial impact of the bill, we are going to bring in Austan Goolsbee. He's an economics professor at the University of Chicago's Booth School of Business. He's also the former chairman of the Council of Economic Advisors and was President Obama's chief economic advisor. He's been following the latest, and he joins us from Chicago. Thank you so much for joining us. Listen, we really don't know how much this bill is going to cost, Austin, but who would be affected the most by it? Do we know that?
Yeah, we have a pretty good sense, Anne-Marie. If you look, people who make less than $75,000 a year and don't have insurance through their employer are going to likely have to pay a lot more. People who either themselves or someone in their families had some illness, they're likely to have to pay a fair amount more. And older people are going to pay more, so the younger people pay less. There are then some arguments on the margin if they change certain things, because there's a really large cut to Medicaid. Will we see hard-hit groups be the children with disabilities in school? They get money from Medicaid. Will we see a blowback into the nursing homes because they get a lot of patients there get Medicaid? Those ones still haven't been sorted out, but those other groups are the first ones hit.
Okay, so certainly some people who are particularly vulnerable may be hit hard by this, but does this bill at least fix some of the problems that Obamacare had? I mean, there are still plenty of problems with the Affordable Care Act.
There are problems, and then there are problems, I guess I would say. It kind of depends on what you view the problems were. So if you view that it was a problem that everybody was lumped in and had to get insurance, and so like a lot of insurance products, if you didn't get sick, you were paying in premia that you didn't get benefits, and the people who got sick got payments. One side views that that's the point of insurance, so that was a feature, not a bug. The other side says, no, we shouldn't be cross-subsidizing, so let's try to take all the sick people and put them in a high-risk pool and let the healthy people have lower prices. The new bill will do that, and so you can view that as a solution, or you can view that as the opposite of a solution.
Yeah, why do you suppose this pre-existing condition coverage debate is so heated? I mean, this was really a sticking point for at least two lawmakers, and the promise of $8 billion more to fund these pools, these high-risk pools, was enough for them to switch their vote.
Yeah, I'm kind of surprised by that. You know, I assume they must have gotten a lot of pressure from the White House or from their Republican colleagues or something, because $8 billion compared to the size of the cost here is nothing. They're cutting Medicaid by $880 billion. So to add $8 billion back is really, they're going to notice. The people who are, 20 plus million people who are going to lose their insurance, they're going to notice when this happens. And I think there is a risk for Republicans that they're going to own everything that happens to the health system once they vote for this. And they don't yet know what it's going to do. There hasn't been a scoring by the Congressional Budget Office, so they don't really know what the implications would be for premia to everyday Americans. And that's a problem. And the reason this pre-existing condition thing is so emotional is, A, there are tens of millions, if not 100 million people who have family members or themselves have one of these pre-existing conditions. And B, we live for 70 years in an environment where insurance companies were allowed to discriminate based on whether you'd been sick. And so we know what's going to happen if you go back to that world, and nobody liked that world.
All right. Thank you so much for your insight. There's still a lot of things up in the air. You know, this is supposed to be making health insurance more competitive. There are a lot of states that only have one insurer now under Obamacare. We will see where it goes, and I'm sure we'll be talking to you again. Thank you so much.
Nice talking to you again.